Mark Greenberg holds the Bennett Endowed Chair in Prevention Research at Penn State College of Health and Human Development. He's the director of the Prevention Research Center for the Promotion of Human Development. And since 1981, that makes him almost as old as I am. Since 1981, Dr. Greenberg has been examining the effectiveness of school and family-based curricula to improve the social, emotional, and cognitive competence of elementary-age school children. Dr. Greenberg is a senior investigator on a number of prevention projects in Pennsylvania, including Fast Track, which is funded by NIMH, Prosper, with Richard Spoth at Iowa State and funded by NIDA, the Communities That Care, and REACH, which is a program funded by the Kellogg Foundation. Dr. Greenberg is the author of more than 200 journal articles and book chapters on developmental psychopathology, well-being, and the effects of prevention efforts on children and families. He consults with government agencies and foundations on behalf of local, state, and federal and international level topics related to child development and mental health promotion. In 2002, he was awarded the Distinguished Research Scientist Award from the Society for Prevention Research, and he is a member of the National Advisory Council on Drug Abuse. Mark has been one of those pioneers in this area of prevention, particularly with prevention in the early childhood stage of development. Let's welcome Mark for our luncheon address. Mark?
Well, thanks. If I can get the PowerPoint to show. I retitled my talk, it's not a sprint, it's a marathon, because I'm going to talk about sustainability today. But before I start, I want to just say how impressed I've been at the quality of the discussion that's going on in the sessions I've been in at this meeting. I think people are thinking deeply about these problems, and I want to hold you just for a few more minutes to think deeply about them, in spite of the fact that your brain is probably full. So there was a prevention policy maker that was on vacation, and he was at the beach in California and with his family, and he kicked a bottle, and a genie jumped out of the bottle, and the genie said, "You get one wish, but only one wish." So the prevention policy maker said that he always wanted to go to Hawaii with his whole family, everybody, but he just couldn't afford the cost of it all, and he wanted to see if the genie could build a highway to Hawaii from California. The genie thought for a while and said, "Well, I said you could have any wish you wanted, but I just don't think we can do this one. I don't think it's actually possible. Do you have a second wish?" And he said, "Yeah. How do we create high-quality, sustainable systems of prevention given the patchwork of funding and policies in the United States?" And the genie looked at him for a few minutes and he said, "Do you want a one-lane highway or a two-lane highway?" So these are complex problems, and it's one thing to have some evidence-based programs. It's another thing to get them to be implemented well and with sustainability, and that's what Dell talked about as the next frontier, and that's where I'm going to go. But where we've been is that we now have a number of these evidence-based programs, and they've been growing substantially. As it's been stated over and over again at this meeting, most still need independent replication, and this is an important scientific issue. Reviews are now widely available, as Dell showed in his talk, and guidelines and laws are encouraging these more and more across the states and in the federal agencies to use these proven programs. But we have a lot of challenges at this point. In some ways, they're more difficult challenges than the early ones. I'm one of the blueprint developers of the past curriculum. Testing the program was the easy part. This next stage that we're all faced with now, that we're all in, is the harder part, I think, and there's a number of challenges. One is implementing programs with high quality and with fidelity. Integration of these programs with ongoing activities that are already happening in our communities, and building sustainability of these programs, policies, and practices. And these are difficult challenges, to say the least. Now, there's a new word for this now, these days. We talk about this as Type 2 translational research. And that is research that focuses not on mostly the development of programs, but on how they can be adopted how they can be utilized and effectively in communities. And this is a quote from Liz Robertson at NIDA. She said, "In the real world, translation of science-based practices often stumble, largely unguided, towards uneven, incomplete, and socially disappointing outcomes." Okay? And many of you in this room probably, and I as a developer, have seen numerous instances where programs that are of high quality, once they're instituted in a community, are done in ways that highly reduce the possibility that they'll actually be effective. So, obviously we need to focus on implementation because programs that are likely to show no effect when they're implemented poorly, it's important to build the right context to effectively implement programs. And high-quality implementation should support sustainability, but not necessarily. We know a lot of things are being sustained now in our communities that are of low implementation quality. So there's a hope that as we implement with more quality, we'll also get more sustainability, but that's right now, I'd say, an open question. Here's just one example. I won't show any more, but this is from Marianne Pence's work at the Midwestern Prevention Project. And what you see is that when there was low implementation quality, the change in marijuana use was zero. It was exactly the same as the control group. At year one, you can see the change. Of course, kids, as they get older, they're going to start to use more, but only in the high fidelity group was there a difference. Okay? And Dale's talked about this, Steve Ost talked about this earlier today. We have lots of data of this kind, many findings of this kind that tell us how important that is. But if we implement with quality, it doesn't necessarily mean that we'll be sustained. So I want to raise questions now mostly about the sustainability process. And there's a lot of questions that we don't have any idea what the answers are to. We're just at the beginning. What factors can improve the sustainability or staying power of prevention programming? How can communities institutionalize prevention programs as they do treatment when the dollars are not falling from diagnoses? How do we get sustainable long-term systems when there aren't payers in the same sense that treatment has? What types of technical assistance do schools and agencies and community leaders need to create this systemic change? Because we're talking not about just a program here or there, we're talking about a systems change. And what conceptual models are necessary to both define and study these processes of sustainability? How do we think about sustainability as a scientific question? Now, I'm not going to answer all these today, but I'm going to give you a little Cook's tour because these are complex problems, and they have no clear answer. I think we'll learn slowly as we've done in other areas, and maybe in 10 years we'll have a good meta-analysis that will tell us some of the clear features that are true across states and counties and programs. But I'll talk about a couple today we've been involved in that are creating models to try to ensure quality of implementation and sustainability. And I'm going to talk about the model that's been developed in Pennsylvania, and I'm going to talk a little bit about the PROSPER model. But let me define sustainability first. I'll call it the continuation of a program or policy following adoption. It's the last stage of implementation, really. Think about it, the implementation process, it's the last stage. You can also think about it as the incorporation of a change in the everyday behaviors and beliefs in a community, or just simply making the change stick. Can we actually make these changes stick over time? So this is a model from CASEL, and if you're interested, www.casel.org. CASEL is the Collaborative for the Advancement of Social and Emotional Learning, and they have a process that they are now called the Sustainability Toolkit that they are taking schools and states through and helping them to start from the very beginning all the way through making program decisions, implementing, monitoring quality, and moving to sustainability. And what you see is in the middle of that circle is leadership, because leadership is probably the primary issue here we must be most concerned about. Now, they break this up, and most models do, into 3 phases. There's the planning phase, where we want to transform our hopes into goals and concrete plans of action. We want to reflect on what we want as a community, evaluate existing strengths and weaknesses, identify measurable goals, create detailed action plans, and select evidence-based programs. And I'll talk about, for example, the Communities of Care model later on, which is a great exemplar of that. Then we've got the implementation phase, which is really where we spend more of our time and not enough time in that planning phase, where we're now training on a program, we're piloting it, we're adjusting it, we're expanding it, et cetera. And then we've got the sustainability phase, and this is the one that we haven't thought about much and is the real challenge. That's the ongoing process. What do we do to make sure that we have the ongoing professional development we need, not a once-off from a short grant? How do we monitor and evaluate and improve over the long run? How do we develop the kind of infrastructure that's necessary to sustain? How do we expand and integrate with what already is going on in a school or a community? What do we need to do to nurture those kinds of partnerships? There are both political and economic partnerships involved. And how do we reflect on and share that progress in the community over time in ways that leads it to be sustained? So there's a lot of factors here you could think about. I'm going to go through some of them quite quickly, things that I think are now anecdotal wisdom and have some empirical data in addition that influence implementation and sustainability. The first thing we need to know is that change requires sufficient pre-planning. As many developers, including myself, will tell you, we get calls all the time that a school or a community has gotten a grant and they want to begin next month. But while the agency may have received the grant, the school district hasn't even been informed yet what's going to happen. And this is the kind of potential that is a recipe for disaster. So we need to think about program adoption carefully because I think it'll relate to sustainability also. We need to think about what we need to do in terms of awareness and buy-in, creating incentives for change, dealing with the past history of program implementation in communities where things have not been done effectively. We need to think about this implementation support system. As you as practitioners need to be very careful consumers to make sure that the system that you're going to work with, the developer or the program, really is going to give you the kind of support that you need to ensure both quality implementation and planning for sustainability. And that means not only sufficient pre-planning, but adequate training, sufficient ongoing support for the implementers, and effective and ongoing communication with the system. And we need a good implementation environment. There are probably some environments that are so chaotic and disordered that no matter what program we put into place, it won't work effectively. And that includes adequate administrative leadership, integrating the program with the other programs that exist in a school or an agency or a state, ensuring the program receives adequate attention, not just the grant for the first year, and from the beginning, planning for sustainability. Now, of course, administrative support and leadership are really critical here. There's always going to be some resistance in a building or an agency or a community to change. There's been a lot of discussion about that as I've gone to sessions the last day or so. And principals and agency directors play a key role, both in the local community, regionally, and at the state level, in really playing this powerful role in moving forward on program implementation and effectiveness. My sense is, from my experience of 26 years with one of the blueprints, is it's often effective to start small with a pilot year that provides ample support to make sure everything is done the way it should be, and that teachers or agency personnel demonstrate feasibility in the context. And then, when you've shown you have good feasibility to do it in this context and people think it's an effective idea to pursue, then to go broader. I often see systems that try to go broad quickly with a diffusion of resources and a poor quality implementation. So this is a process. Sustainability is not something you think about near the end of a project, but really at the beginning. It requires buy-in from teachers and administrators and agency directors who have sufficient experience to see the program work effectively. And I think it takes on an average 4 to 5 years of implementation before we'd see a process of going to sustainability in most programs. Okay? And I'll give you some experience of that, of what we've learned in Pennsylvania and in Prosper. So the large-scale diffusion of research-based prevention, Pennsylvania has been an incredible experience for me. I moved there 10 years ago and luckily met some incredible people, Clay Yeager and now Mike Pennington, directing the Office of Juvenile Justice and Delinquency Prevention for the Commission on Crime and Delinquency. And Mark Feinberg and I and many other people have worked to help them understand and refine what Pennsylvania has done. And Clay and the Juvenile Court Judges Commission had the vision in 1992 to think about choosing communities of care, developed by David Hawkins and Enrico Catalano. It mobilizes local communities. Most of you probably know how it works, but the idea is to establish a prevention board that is well-trained to oversee local assessment, planning, and implementation processes. The board members undergo a series of trainings and get ongoing strategic technical assistance, and the board develops a long-term prevention plan based on the assessment of risk and protective factors and the needs of that particular community. And they then select from, as you know, evidence-based programs. Why did Pennsylvania choose this model? I think because it builds community readiness. It prepares a fertile ground for making sure that when we do programs, we'll do them with a community structure in place that's thoughtful. And as we know, even today, programs are often selected on the availability of grant funds. We've got the money, so let's do the program. Or we write for the program because that's where the money is. Rather than thinking through what we in an individual community think is the issues that we should address. So CTC sort of turns that on its head. It identifies a need before choosing a program designed to meet that need. And I think that's part of this, again, pre-planning process. It makes sure the programs fit the risks and the strengths of the community, and it provides a roadmap over time for how to do this. So Pennsylvania first funded communities in 1994. I'm making Clay feel older than 1891. 8 sites were funded. But quickly, the governor and others became very excited about this, and it broadly expanded. Quickly, it divided into 5 regions, and each region had a regional strategic consultant. You might call them a technical assistance person. And from 1995 to 2002, 127 communities in Pennsylvania each received 3-year grants to be completely trained in communities of care. Okay? It's an enormous structural change. Although there are 501 school districts, 127 communities sounds like a lot. It's still not near the reach we would want to have. Is the model sustainable? Well, so we've tried to study this model now over time and what happens to these communities. And what we find is over 2/3 of these CTC sites that receive the startup funding remain active and functioning in Pennsylvania today. Okay? Some have lasted as long as 12 or 13 years now. PCCD has created an infrastructure to build and support these coalitions, and that's important. They just didn't have initial CTC training for a year and let them loose. By building these strategic consultants, regional facilities, and having ongoing proactive technical assistance, it's made an enormous difference. It creates a structure and a uniformity and function that means that all the communities are really following the same kind of model. So here's a sort of a fancy statistical model, a survival function, where we try to estimate the percentage of CTC sites that will survive after they lose their state money. They get state money for 3 years or so. Some of them got a couple more years of a smaller amount of what was called sustainability support, and then they're let loose because the belief is that unless local communities, county commissioners and mayors and superintendents of schools and judges, if they don't believe that this kind of process is worthwhile at the local level, then it's not really a sustainable process. And what you see is that at zero would be the time at which the sites would be let loose from their state funding. About 10% of them die a quick death. That is, they can't sustain themselves after they lose the state funding. But you can see that there's a very gradual diminution after that, and even after 4 years, about 70% of the sites are still existing and actively working in their communities. They're reassessing their risk and protective factors, they're picking new programs, and they're writing and being funded to do new evidence-based models. So 4 factors. So we looked over time at these communities and what factors are predicting which CTC sites die off and which ones sustain themselves. What is it that makes a difference? Because if we don't know this, we're not going to learn better how to provide the right kinds of technical assistance and help communities move forward in a way that's going to be lasting. And we found 4 things that are most important. One is the quality of the way the board functions. The board's meeting every month or so. And how that board functions, its culture and its leadership are really important. So that when we had both the strategic consultants independently rate the quality of these boards' functions, and when we had all the team members in each community go on the web and fill out measures, we found that both the team members' reports of the quality of their board and how it functioned, its culture and its leadership, as well as the outside technical assistance ratings, both predicted which communities survive and which don't. Okay? So that means putting technical assistance in to really help people know how to run these boards, how to run meetings effectively, how to be strategic in who you select to be on the board, how to, Woody Allen has this saying, he says, if relationships are like a shark in the water, if they don't keep moving, they die. And it's the same for these kind of community coalitions. You have to breathe life into them on a regular basis. Why would people keep coming to meetings every month? Right? They have to be motivated, and there has to be good technical assistance that creates a kind of leadership and culture that makes people believe that there's more benefits than cost to this kind of activity in their community. The second is the fidelity of the model. We actually rated how much fidelity they actually showed to the model. And those that did more, had more fidelity to the model, were the ones that were likely to survive. Again, that's why technical assistance, proactive and ongoing, is critical if we're going to sustain things over time. The third is the management of changing board membership, because you know how you've all been on many community boards, I'm sure. People stay on boards 2, 3, 4 years, and you have to expect over 3 to 4 years you're going to have between 40 and 60% turnover. So how you manage that turnover of membership of key leaders in a community when they change positions or they get involved in another board, et cetera, is very important, because we often saw turnover where we'd come to a CTC site maybe 5 or 6 years out, and no one was an original board member, and they weren't oriented to what they were supposed to do, and they'd lost the feel of what the goal was. Okay? So again, this ongoing management of board membership is important. And then the last was how effectively they planned for sustainability. We rated each year how effective we thought they were in thinking ahead, and those that thought ahead and really planned, it paid off. So Pennsylvania was visionary not only in funding all these sites to begin the process, but then they did what I call build it and they will come. In 1998, the Pennsylvania Commission on Crime and Delinquency, through Clay's Office of Juvenile Justice, began what was called the Research-Based Prevention and Delinquency Initiative. After CTC was established, so now we have all these communities in Pennsylvania who are geared up, they understand risk and protective factors, the public health model, et cetera. Then they began to fund for 4 years, very innovative for a state, research-based programs, both blueprints and other programs that were originally in the CTC book. And many programs have been funded. There have been 160 evidence-based interventions funded over 10 years, about a $60 million investment. So this is, I think, a really good laboratory for us to learn from. And it includes all the kind of programs you'd think: Big Brothers, Life Skills, Strengthening Families, MST, FFT, all the acronyms. And so we've been trying to study both the implementation and sustainability not only of the CTC sites, but now of these programs. And what factors lead the programs, which are also funded for 4 years, to maintain and run in their communities once they lose their money. Because in the end, we have to think about much of sustainability as local. So take a county that I live near, has about 150,000 people, and has a $130 million a year social services budget. The state is not going to fund these in the long run. We have to reform the way local decision-making is made by county commissioners, mayors, et cetera, in order to really make the kind of change we're talking about. In fact, I don't think it takes much new money. I think it takes a restructuring often of the current funding that's there. So we've had a lot of investigators and collaborators in this process, including Mike Kane, the director of the commission, who's here today. And just to give you a sense of kinds of programs that communities write for, because the communities decide what they want to do, you see quite a percentage for classroom-based programs, community mentoring programs, family prevention programs, and family treatment programs. And there are all kinds, all the ones you'd expect. So the question is now, after they've gone off their state funding for 4 years, which ones last? What makes something last, and what kinds of programs last? And first you can see here that 76% of the programs, 2 years after they've lost their funding, so now we're 6 years into the process, about 76% are still maintaining, they're still sustainable, and about half those are sustained at the same or a higher operating level than they were when they began their funding. Okay? And about 24% have lost their ability to maintain. They couldn't find the local funding. They couldn't get the excitement at the local level. So we looked at a variety of factors that might predict this. And I won't go through all of them today. We all are probably going to the airport, including me. I'll see you there at 3. I don't want to talk about a couple of these. One is the different types of programs become more or less sustainable. And we found, as you can see, if you look at the blue, those are the ones that are operating at the same or a higher level 2 years after they've lost their funding. And what you see is that the classroom-based programs are doing pretty well. The mentoring programs are doing pretty well, because most of them, I think, are Big Brothers programs that already had a structure in many cases before. Family prevention programs really struggled to be sustained over time. And family treatment programs did pretty well. And in fact, in Pennsylvania, they're doing better now even, I think, than this data, because Pennsylvania, through the efforts of the Commission on Crime and Delinquency, has now parlayed that into Medicare funding for numerous of these programs like MST, Nurse Family Partnership, et cetera. So another question that always is asked, and I've been asking for many years, does readiness matter? So everybody says, well, you shouldn't go into communities that aren't ready, and if there isn't good readiness, then nothing's going to happen. It's like throwing money down a hole. And we didn't find that to be the case. We found that readiness did not predict sustainability. So we did measures defining community readiness at the beginning for each community, and what we see is that there's no relationship between communities that were more or less ready and how they're doing 6 years later, okay? How they're doing in the first year, I'm sure it was very predictive, and we have lots of data on other projects showing that that's true. But it may be oftentimes that in the communities that aren't ready at all, that if we persist with them over time, we actually get more change. And I'm very concerned about how we talk about the readiness construct these days. We also looked at how connected they were to a community coalition. I told you that CTC was in many of these communities. We also had health coalitions in these communities of different kinds. And we looked at how connected they were to a coalition. Because in the long run, we thought that if they were connected to a coalition, they'd have more local, broad-based community support, which would lead them to be more likely to sustain. And that's exactly what we found. So what you can see that in 67% of the cases in which there was no connection, strong connection to a coalition, they didn't last. But as you can see, when they were connected to the CTC coalition, when the CTC coalition was very active in this process with these programs, they were much more likely to sustain. So programs exist in systems, and that's very important for us to really take seriously as we think about how to implement blueprints and other programs. So we had significant differences by program type. The connection to a local coalition and community and school leader support were associated with being able to sustain. But readiness at startup, implementation quality, and the assessment of program impact were not. Okay, so how well they implemented in quality didn't seem to predict their sustainability, nor did the assessment of their program impact. Some were much more focused on assessing their impact than others. So let me switch now to another kind of project. It's not a state project like Pennsylvania's unusual experiment, but it's the PROSPER project, which Richard Spoth and I directed Iowa State and Penn State. It's funded by the National Institute of Drug Abuse, and it's really for the same process in a way. The problem that Dick and I felt was that there are many places in America where people are not using evidence-based programs, but even where they are, oftentimes they either are not implemented with effectiveness or they're not sustained over time. And just like CTC is a system that can help us, I think, to sustain programs, which is the big picture long-term goal, isn't it? It's not one generation, it's 10 generations of the program. And that's what Steve Eos was talking about earlier today about the cumulative effect of interest, compound interest. In the same way, we felt that there should be other systems that we could use to do this. And both being at land-grant universities with Dick's leadership, we began to become much more connected, as he already was, to the cooperative extension system, which is the land-grant system that operates in every state in the United States to do that. And we've been doing a randomized trial now. It's in its 7th year, where we have 28 communities. They're randomly assigned to intervention or a delayed wait list. 14 communities in each state, 7 intervention and 7 comparison. And we have about 11,000 kids we've been following across the period, all starting as 6th graders. And each community selected from a list. We gave them a list of 3 programs, what we thought were the only 3 evidence-based programs that we felt had sufficient evidence. And they picked a family-focused program for their community in 6th grade and a school-based program in 7th grade. And we provided 2 years of funding to support completely the implementation of each program. But after those 2 years, we did only small matches in year 3 and 4, but we continue to fund the extension agent who works with the community as the leader, but we give them no more program support. And the question was, if communities created these kinds of structures, and I'll show you what the structure looks like. We have a local strategic teams led by a cooperative extension agent and a middle school and a co-leader from the middle school, and we have small strategic teams that involve parents, someone from substance abuse or mental health, maybe an important stakeholder like a priest or a probation officer or a judge. We have the university team of us at that level, and in between we have what's very important is a very active, proactive technical assistance team we call prevention coordinators that are out in those communities all the time, continuously now, for 7 years, working with them to sustain this process effectively. And our goals are, of course, to improve positive youth development, to prevent risky behaviors, as you would guess, to make sure that programs are administered with quality, and that we build sustainability. The question is, can we build more sustainability if we really take seriously the dictum, start talking about sustainability at the first day, and work through systems that already exist in communities. Cooperative extension exists in every community, some in more, some states it's stronger, some states it's less strong, some communities it's more strong and less strong, but it exists everywhere. So this is a big picture issue. It involves extension personnel, public schools, prevention researchers, community citizens, all working together, picking from a menu and using programs. And if we fund them for just a couple years, but continue to give them strong technical assistance, the question is what will happen over time. So strong emphasis on sustainability planning and local capacity building. We have a lot of professional development for our teams through learning communities, which I really can't spend time on today. We engage the whole team from the beginning in sustainability planning, and we spend a lot of time talking about sustainability, helping them do everything you'd imagine that might lead to sustainability. And we have a sustainability model, which is too small to see, but I'll just tell you that there's two parts to it. One goal is to sustain the quality of the programming, to make sure that programs that are run effectively with high quality implementation, and that means maintaining strong relationships to schools, et cetera. But the other is a well-functioning team, because I told you what we learned from CTC, that the quality of these teams is critical for the long run. And so we spend a lot of time on building effective internal and external relationships on these teams, of recognizing people, of developing communication plans, of creating strategic partnerships in our community, monitoring the team structure, conducting effective meetings, et cetera. So what we found so far? Well, by year 5, they were a year and a half off of any of our program money, and we found that all teams and family programs sustained in year 5, so that all 14 communities were sustaining themselves, and 12 of the 14 school programs were sustained. We found an enormous number of ideas in local communities about how to sustain. We have alumni groups of parents that have gone through the programs that raise money. We have the typical car wash and bake sale, but we have a variety of really innovative techniques that our local communities have come up with, including state funding and county funding, et cetera. We spend a lot of time developing PowerPoints and practicing them. One PowerPoint goes the United Way, a different one goes to the school board. There are very different desires and goals of different groups in the community. The teams have institutionalized the monitoring and implementation fidelity. All teams every year must monitor and assess the quality of implementation of each of their programs. And the teams are guided by that sustainability planning model I showed you that you can't actually read. Several teams actually have become so popular in the communities that neighboring communities have come to them and asked them now to expand into new communities. So we see also, naturally, without any effort, actually expansion into a variety of new communities, especially in Pennsylvania right now. So the question is, what factors will lead to good sustainability? Well, we mostly have been looking at the sustainability planning, but now we've looked at the number of dollars they've raised, and pretty much we're finding the same things. And that is, just like I told you for the 127 CTC sites in Pennsylvania, it's the quality of the board functioning. How boards work makes so much difference to sustainability. The second is how they oriented new team members. Just like in the CTC sites, we realized we had to write an orientation manual, and when a team had a new member, that the team leader had to take them out to lunch and tell them what Prosper was about and give them an orientation and have them really join a process. Because you might come from an agency where you think, well, I'm coming from my agency, now I'll get my agency some dollars, or I'm going to help them to do what I want to do now rather than what the plan is. And so really orienting them effectively is important. The third was that members, teams that saw more benefits and costs in participating, had teams that did better sustainability planning and now are raising more funds. And this, you could think about it in a way as a part of the culture, again, of the team. So, what's the bottom line here? If I could give you a bottom line, it's always those multi-circles. That is, we've got programs. But programs will never survive by themselves. They survive inside of organizations, and those organizations survive inside of communities. And those communities will survive in the use of those programs if they have good TA systems in place, strategic consultants or technical assistants that really are permanent parts of our structure in the United States. And those are related to the planning that states have. We have to think about this much more systematically if we're going to take seriously the big picture that 20 years from now, while none of us, or very few of us will be here, there'll be people just like us, and they'll know a hell of a lot more than we do now about how to transform and sustain the transformation of services in the United States. So, in closing, and I am ready to close, Dell, moving to sustainability is important, and how to think through this is something that as you go home to your communities, I hope that this talk will spur you to think more about. It's moving from being special, which is what that whole grant process is into how normal business is done. It's not special, right? It means relying no longer on champions, because as long as you rely on champions, right, you're vulnerable at any single moment that the champion either decides to champion something else or it leaves their powerful position. And that means you need infrastructures of support. Clear strategies for training and coaching, technical assistance, data systems to show accountability so you can continue to show what impacts you're having on your community, and the use of that data for ongoing improvement. So the bottom line, the challenge that I'll leave us with is that we're going to continue to see, I don't think there's any question, broad dissemination of a growing number of evidence-based programs, including, of course, the blueprints. And that it's unfortunately mostly going to be through discretionary grant programs. Because we don't have a permanent Medicaid or other funding stream that will pay for most of these, with the exception of programs that are more treatment-oriented, like MST, FFT, in some cases nurse-family partnership, multidimensional treatment foster care. The programs are all going to face the challenge of sustainability. Some of you have already faced it. We have at best what I call fledgling science of change, of systems organization and prevention research. We've hardly begun to even scratch the surface of what we need to know to help all of you do a better job in sustaining. And understanding and helping communities build sustainable prevention is really the central challenge, as Dell said, of the next frontier. But this is going to take some different kind of ways of doing business than I think we've done in the past. Prevention scientists like myself, or David, or Dell, or anyone in this room that's been a developer, we're going to need to learn more from practitioners than we know now. Because to really learn what makes something stick is going to mean that we're going to need to understand more about how to broadly disseminate these ideas. And what we've learned in both CTC and Prosper is that many of those answers don't come from us. They come from the field, and then they get brought into systems. Because none of us ever were trained in organizational change. We were trained in how to develop and test an effective program. This is really now a new territory for all of us. And I think the more we work together, practitioners and prevention scientists together, we'll begin to face this challenge. So with that, thanks and safe travels.